Imagine a treatment that hunts prostate cancer cells like a GPS-guided missile. No surgery, no weeks of external radiation, just a targeted particle that travels through your bloodstream, locks onto tumors, and destroys them from the inside. It almost sounds like science fiction, but it's real. It's called Lu-177 therapy, known commercially as Pluvicto. And for thousands of men fighting advanced prostate cancer, it's become one of the most promising breakthroughs in years. Today, we're going to break it down simply. What Lu-177 is, who qualifies, what happens during treatment, side effects, realistic expectations, and what patients can do to prepare. Because the more you know, the more power you have over your health. 1. What exactly is Lu-177? Lu-177 is a type of radioligand therapy. Let's break that into plain English. Radio equals radioactive particle that can damage cancer cells. Ligand equals a molecule that acts like a key, helping the radiation find prostate cancer cells. Most prostate cancer cells have a protein on their surface called PSMA, prostate-specific membrane antigen. Lu-177 uses a ligand that sticks to PSMA. So when it enters the body, it searches for, attaches to, and destroys cancer cells that carry PSMA. Think of it like a heat-seeking missile. It targets only cancer cells, delivers radiation directly where the tumor is, spares most healthy tissue. This is why doctors sometimes call it a smart bomb for prostate cancer. 2. Who qualifies for Lu-177? According to major cancer centers like Cleveland Clinic, Mayo Clinic, and Harvard Health, Lu-177 is mainly used for men with metastatic prostate cancer, cancer that has spread to bones, lymph nodes, liver, or lungs, castration-resistant disease, meaning the cancer keeps growing even with hormone therapy. Positive PSMA PET scan. Cancer cells must express PSMA, or the treatment won't stick to them, so it's not a first-line therapy. It's usually offered after other treatments stop working, such as hormone therapy, chemotherapy, or external beam radiation. 3. How does the treatment work? Treatment is usually given once every 6 weeks with a typical total of 6 cycles. A patient goes to the hospital or cancer center, receives an IV infusion, and can go home the same day. There's no surgery, no overnight stay, and no long recovery. Once infused, Lu-177 moves through the bloodstream, finds PSMA on cancer cells, delivers a controlled dose of radiation. Tumor cells break down and shrink over time. Results don't happen overnight. Some patients see improvement in a few weeks, others in a few months. Doctors monitor this using blood tests, scans, and PSA trends. 4. What benefits have patients reported? Across major clinical trials and real-world patient stories, lower PSA levels, reduced bone pain, better quality of life, reduced tumor size on scans, slower disease progression. Many patients describe something emotional. For the first time, they don't feel like the cancer is chasing them. They feel like they're chasing the cancer. 5. Side effects. What's realistic? No cancer treatment is side effect-free, including Lu-177. But according to Harvard Health and Mayo Clinic, most symptoms are mild to moderate and manageable. The most common: fatigue, dry mouth, nausea, loss of appetite. These usually improve with hydration, rest, and supportive medication. Less common but more serious: low blood counts, red cells, white cells, platelets. Infection risk: bleeding or bruising. That's why doctors monitor blood work between cycles. If levels drop too low, treatment pauses until the body recovers. But here's the good news. Most patients can finish all 6 treatments, and many have a good response. 6. What's a typical day of treatment like? Patients often say it's easier than chemotherapy. Arrive at clinic blood pressure and labs checked IV placed in arm infusion for about 30 to 60 minutes. Observation for a short period. Go home. Some centers recommend drinking plenty of water afterward to help flush radioactivity safely. There are usually mild radiation safety precautions, such as avoiding close contact with young children for a few days, flushing twice after using the bathroom, extra hand washing. Nothing extreme. Patients are not locked away, isolated, or glowing in the dark. Yes, many ask that question. 7. Will insurance pay for Lu-177? In the US, many insurance plans, including Medicare, now cover Pluvicto for qualified patients. But approval depends on PSMA PET scan positivity. Prior treatments tried. Medical history patients should talk to their oncologist and insurance case manager. Some cancer centers offer financial assistance programs. 8. Realistic expectations. Lu-177 does not cure metastatic prostate cancer. However, research shows it can extend survival, reduce symptoms, slow tumor growth, improve quality of life, give patients more time with family. And for many men, more time is the most precious treatment outcome of all. 9. Tips to prepare for Lu-177. Practical advice. Doctors at Mayo Clinic and Cleveland Clinic commonly recommend: stay hydrated, helps kidneys flush radiation, eat light meals on treatment day, track energy levels, report bruising or unusual bleeding, ask about dry mouth relief options, keep all follow-up blood tests. Patients often say that simple things help: ginger tea for nausea, short walks to improve fatigue, healthy snacks when appetite is low, rest after treatment days. Small habits can make a big difference. No one chooses cancer. No one asks for PSA numbers, scans, or infusions. But science is moving fast. Just 10 years ago, treatments like Lu-177 were experimental. Now they are changing lives around the world. And if you're watching this for yourself, or for someone you love, remember this: prostate cancer is strong, but medical science is stronger, and you don't have to fight alone. If you want to learn more about Lu-177, PSMA PET scans, proton therapy, or every new treatment changing the future of prostate cancer, make sure to subscribe, like this video, and join us every week at 9 p.m. Because here on Nourish Today, we believe knowledge is healing, and sometimes a little education can be powerful medicine. And no, Lu-177 won't make you glow like a superhero but feeling hopeful again? That's pretty close.